prescription, it's usually for medicine. But for some patients suffering with chronic lung and immune conditions, a GP can also prescribe them cash to help them pay for their energy and heating bills.
Well, it's part of a trial taking place in parts of England to prevent people from needing even more expensive hospital treatments. Our cost of living correspondent Coletta Smith has this report.
My joints ache like there's no tomorrow. My bones feel like hot pokers, and I tend to end up either bedridden or, in the past, I have ended up in hospital a few times with pneumonia, flu, pleurisy.
With arthritis and a serious lung condition, Michelle and her young teenage girls usually dread the winter. But not last year, because the NHS paid the entirety of her energy bill.
It's mind-blowing how much of a difference it does make. It makes you happier, you're a bit healthier, you're not as in pain, so you're not snappy as much, or, you know, you're not stuck in beds.
So for you, it wasn't just a health benefit.
We had a nice Christmas, which doesn't happen very often, to be honest. My children being able to have a life and be children, not having to just be mums carers.
There are millions of people with cardiovascular and respiratory conditions that are made worse by living in a cold home.
Matt was the brains behind this pilot project, but it's the health service who made the decisions about who qualified.
So it's for people with the right health condition who can't afford the heating they need to stay well and warm and well at home. For the health service, they were saying this was having a benefit much more quickly than the pills and potions they normally have to give out. So it was days, not weeks or months.
Despite energy bills being more expensive this year, NHS Gloucestershire saw such a benefit that they're now helping 5 times as many people. And Tees Valley and Aberdeenshire are joining in too. The reason this pilot scheme has worked so well here is that they've had a willing GP who knows people's health conditions working in this surgery alongside social prescribers and people who visit homes regularly and know people's financial conditions. They're therefore able to marry those two things up together and find the people that qualify under both criteria.
Do you want to just tell me about your cough that you've had?
Dr La Roux says this project wasn't an extra pressure on him as a GP.
It's going to save work because actually hopefully going to be keeping patients fitter and well over the winter and stop them getting sick. So I think it's actually saving the money for other services. Doing that work upstream ahead of time, ahead of the winter, so that they're as prepared as they can be. It's just a fantastic feeling to know that, you know, you're doing that bit of your job rather than always going to see sick people.
Michelle's hoping everyone can feel warm and well this winter.
If everybody could have the help that I was fortunate enough to actually experience, I think it would make such a difference in people's lives.
Coletta Smith, BBC News in Gloucestershire.
Let's talk about this, shall we? Because potentially it affects so many people. How does the cold affect our bodies? Could prescribing like that be of assistance? We're joined now in the studio by Professor Damien Bailey, who's from the University of South Wales and relieved this morning after the football. Yeah. Good morning. Thanks for coming in, morning. Damien. Should we just talk about that prescribing thing to start with? I know you're not directly involved in that scheme, but do you think it makes sense?
Certainly. I mean, it makes huge sense to me. I think it's, regardless of where the money comes from, keeping people warm, the impact it has medically on people in terms of quality of life and physiological function, I think is fantastic.
And one of the things that I know the study found is that it's the colder we get in our homes, everything slows down, doesn't it? It's not just the physical effects, also cognitive effects too.
Yeah, that's right. I think the brain is almost the forgotten organ in all of this. We focus so much on the heart and the lungs, the muscle and the skin. Of course, that's important. But the brain is the master. Everything else is the slave. It's sending those signals. And we know that by reducing blood flow to the brain, there's not enough fuel, not just to burn at homes, but to burn in the brain. And this causes mental gymnastics, our ability to perform cognitive functions to decline. So the quality of life becomes less.
You've been doing some special tests for the BBC, haven't you, with James Gallagher, our science correspondent and presenter, where you put him in conditions where his temperature was reduced, the surroundings were reduced. Just talk us through what's happening here in these pictures and what you discovered.
Well, here's James. I mean, he's effectively wearing a lot of different medical equipment. We're measuring blood flow to his brain, his breathing frequency, skin temperature. We're measuring a whole range of things on his body. And as he gets colder, only down to 10 degrees centigrade, which is really quite subtle, James's blood pressure shoots up, his heart rate shoots up, he breathes a little bit more quickly, a bit more deeply. And importantly, he reduces blood flow to his brain by 20%, which is really quite marked. And as a result of that, his mental gymnastics was impaired.
And that's only at 10 Celsius. So you know, a cold house on a cold day with no heating could get to that.
Absolutely, and we chose 10 degrees centigrade because, and it was only 30 minutes. That's the average house temperature over the winter season. I mean, my house yesterday was 5 degrees centigrade. So,
wow.
You know, it's very, very subtle. And, you know, James was sitting there shivering. His fingertips were white. I think he was quite surprised how marked the physiological response, his body's response was to that reduction in temperature.
So when your house is 5 degrees, what do you do? And this is a slightly daft question, but what are you like layering on jumpers, coats? How, you know, what's your advice for people whose house is cold?
Well, I think it's important that we dress appropriately. Of course, we can insulate ourselves, reduce the convective heat loss. You know, wool-based clothes. Mountaineers, for example, they've figured this out quite some time ago with, you know, woolen-based clothes. We can change what we eat. We showed in that piece that James was actually burning more carbs. His brain was burning more carbs, which is interesting. So that's a good excuse, perhaps, to eat more carbs. Our fuel changes. And, of course, we can move around. And it's really important for the elderly folk. If they can try to ambulate and just generate some heat. Our main heat producers, our main radiators are our muscles, and that's really important.
So keeping covered up, but I guess you know, things like moving might not be that possible for elderly people, and buying more food isn't possible for a lot of people at the moment, isn't it? It just all comes back, this cycle.
It's a challenge, there's no question about that, and I think the older we get as well, our ability to thermoregulate, to defend that core temperature is reduced. And of course females, they feel cold far sooner than us males.
Is that true? Or is that's not a myth, that's definitely true?
Yeah, it's not a myth. There's evidence to support that. What I would say is we need to do much more research to demonstrate these differences, but estrogen reduces the blood flow to the periphery, females feel colder sooner, and of course there's less muscle mass generally, so those radiators that are generating heat are a little bit fewer than compared to the males. And
at what point should somebody really start getting worried about their situation? I mean, hands getting cold, but you know, what would your advice be about things to look out for when it gets serious?
Well, cold, we know, is a killer. We know that it's a risk factor for stroke, it's a risk factor for a heart attack, and also it's a risk factor, we feel, for accelerated cognitive decline. So I think it's really important that people stay physically active. They try to look after themselves as best they possibly can. But there's something that we can't escape here. It's that chronic exposure to cold is a killer. And so it's really important that people are at least aware of this.
And when you say chronic exposure to cold, what sort of time frame are you looking at?
Well, we saw with James 30 minutes. I mean, just a pure for 30 minutes. I think, again, people don't understand the impact it has on the body just at 30 minutes. But again, older people perhaps might be sitting at home for several hours, days, weeks, months on end at cold temperatures. So again, these are the at-risk and vulnerable. And those that are carrying medical conditions, for example, heart problems or lung problems, again, they're at increased risk. So again, it's really important that people are aware of this and really try to ambulate, to move around and try to generate heat. OK.
Thank you so much for coming in, Damien. It's a fascinating subject area, and I know it's something that matters an awful lot to people right now as they're trying not to put the heating on. So we appreciate your insights. We also appreciate you coming up last night, and so you had to watch the match on your own, yeah?
Absolutely.
That got the blood pumping.
Oh, no question about it. There was probably a 20% increase in blood flow to my brain.
And if you want more information about what we've been talking about, it's all on the Inside Health podcast on BBC Sounds.
It's a really good listen, isn't it? Listening to James and what happened to his body. Right, stay